Hi, good morning. I'm Julia Standefer, a nurse practitioner with Oscar Medical Group's virtual primary care. My specialties include women's health with a focus on contraception, lactation consultation, hormonal therapy, mental health, cancer screening, and general primary care, so plenty of chronic disease management. At Oscar, our focus is providing people with access to the affordable, high-quality healthcare that they deserve. And a large part of this work is providing preventative healthcare that allows individuals to take greater control of their health. Today, we'll be discussing some of the health issues most prevalent in women and providing some tips on how to advocate better for our health, both in our own lives and when seeking care. I'd like to welcome Dr. Shoup from AdventHealth, and I'll hand it over to you now to give some background on your role and organization.
Yeah, so I'm a GYN oncologist at AdventHealth and Shawnee Mission in Kansas, and I've been in practice for about 17 years. Our focus as GYN oncologists is less on prevention, more on treatment, but certainly prevention is key to prevent you from getting to me. So it's certainly close to our heart as well.
I'm curious. So as we reach coming up on the 2-year mark of the COVID-19 pandemic, what would you say are the main gaps you're seeing in terms of health visits and screenings that you would typically encourage women to get on a regular basis?
Well, certainly there have been people who have neglected to go in for good reason to avoid, large groups of people or healthcare settings during the height of the pandemic. They've avoided getting their pap smears, their mammograms, colonoscopies, or even just their routine follow-up visits for surveillance of cancer that they may already have. We absolutely recommend continuing annual visits. And if you have neglected over the last 2 years getting seen, certainly don't hesitate to go in just for a checkup, or if there's been something that doesn't seem right, it needs to be evaluated. Don't hesitate.
So in terms of what women can be doing at home to self-screen for health conditions, does anything come to mind?
Well, I think women in general are very in tune with their bodies, and we're used to having changes that occur over the course of the month. And if things don't seem right, you are your own expert on how your body works. And if something doesn't feel right, seem right, certainly that's something to bring to your healthcare provider's attention. To be very specific, obviously, nodules or masses in your breast that you feel, abnormal bleeding, changes in your menstrual cycle, changes in your bowel function, changes in your bladder function, all things that maybe you don't really want to talk about. But if you've noticed something that's changed and persisted for a couple of weeks, that's something to bring to your healthcare provider's attention.
Keep asking those questions if you have that concern. Definitely.
Yeah, we certainly get those patients that have been misdiagnosed or just delayed in their diagnosis because the symptoms often are vague, or maybe they neglected their symptoms for a period of time. Their healthcare provider neglected their symptoms or didn't think their symptoms were something problematic for a period of time. And then finally, when something gets done, it's more of a problem than when it initially presented.
Now, sort of a hot topic, I would say, in regards to your field, more specifically than mine in primary care. What does it mean to have a genetic predisposition to cancer, and which of the cancers that we hear most about are more thought of as being hereditary?
I mean, this is a huge part of what we take care of are women with familial or hereditary predispositions to cancer. And I mean, I think most people know about the BRCA gene or the breast and ovarian cancer gene, but also uterine cancer and colon cancer, pancreatic cancer, melanoma, all those things can be hereditary type cancers. So it's really important, one, to ask questions about your family, your parents, their siblings, who has cancer, what kind of cancer they had, and just keep that sort of in a mental note in your mind and bring it up with your healthcare provider. Sometimes people with really small families don't have any red flags in their family history, but they still can carry a gene because maybe they only had male relatives, so that no one actually had the breast cancer, but they can still carry that gene forward and be at increased risk. So it's something definitely to know about your personal and family history of cancer and discuss with your provider. If you were flagged as someone who may have a genetic predisposition to cancer, there's absolutely things we can do to reduce your risk of getting those cancers. It's not like, I have a lot of patients who don't want to have testing because they think, why do I want to know if I'm just going to get cancer? But information is powerful. It absolutely has ways for us to reduce your risk of cancer and even prevent cancer. And cancer is so much easier to prevent than it is to treat. So don't be afraid of having that conversation and considering getting tested. And I think a lot of people too are fearful of insurance consequences if they test positive for genetic predisposition, but actually it is protected with the federal law against discrimination for health insurance. So, I've yet to see a patient have insurance consequences from having a test that identifies them at high risk.
Aside from knowing your family history, knowing your family tree, who had what, is there anything else a woman can do on her own without the testing to help her zoom into what her genetic risks may be?
I mean, I think certainly knowing your family history is probably the most important part, and discussing with your primary provider. I think people, like I started this topic talking about the breast and ovary cancer gene, a lot of people don't know that uterine and colon cancer are linked, and they are uterine cancer is actually the most common GYN cancer that we see. And people with that syndrome, that familial hereditary syndrome, half of the time will present initially with uterine cancer first before they have colon cancer. So we see those patients after they get diagnosed with uterine cancer. We screen all of those patients, and if they opt for genetic testing, then their colon cancer screening changes significantly. The most common presenting symptom of endometrial cancer is abnormal bleeding, which, that happens a lot of the time for benign reasons, but that is one thing that if you start to notice that, heavier periods, more frequent periods, intermenstrual bleeding after intercourse, all those things should be brought up with your healthcare provider. I also think, during COVID, and with, this is a whole nother topic, but the new pap smear guidelines, they certainly have changed the interval for when women see their gynecologists. A lot of people assume that if I don't need to get my pap smear, I don't need to be seen, and that is not the case. You should be seen once a year by your healthcare provider and have a gynecologic checkup once a year. Whether they do a pap smear or not during that visit is very individual, depending on your history, your pap smear history, your current symptoms, your age, and which pap smear you had done previously. So there is a whole bunch of variables on when you actually have those done. But the easiest way to remember this is you still need to go in once a year and have an exam and a discussion about your gynecologic health, period. That's gotten forgotten in all of that conversation.
And of course, most people know this. Back to the GYN cancer risk, smoking and alcohol certainly contribute, and people won't necessarily have connected those two things. So just pointing that out, like, yeah, your casual, smoking habit that you don't really think about a lot, like these are all things that we can mitigate your risk with.
The other thing that I have noticed, and you probably have too, over the COVID pandemic, is weight gain. Patients have tended to gain weight, and as I see them with serial exams, their weight just continues to go up and up and up and up. And along with all the other medical issues that goes along with, uterine cancer, one of the risk factors for uterine cancer is actually obesity. So, we are seeing an increase in obesity rates and an increase in endometrial cancer rates. And it's a major health issue. I think COVID exacerbated that by having everyone at home. The gyms were closed, you were close to your refrigerator, and it just kind of became an unfortunate side effect of that process.
I see that so much right now, and it's at the forefront of most women's minds. And that leads me into my next topic, actually, which so much right now, like I would say more so than ever, I guess, with the amount of stress that women are under. I'm getting like women coming into the clinic saying, I know my hormones are out of whack. My periods have gone crazy. My weight has gone crazy. I'm losing hair. I need hormone testing today. Thoughts on how you would counsel these folks?
First of all, menstrual irregularities need to be evaluated for some cause. If no identifiable cause, cancer or what have you, is the source, certainly you can have hormone fluctuations from stress, from weight gain, from diet, from, there's a whole list of things that can do that. It isn't, the fix is not as simple as just testing your estrogen level and replacing it with something. It's multifactorial, and I think it's lifestyle and how you manage stress. Everyone has different ways to manage the stress that they're under. For some, it's exercise. For some, it's meditation. For some, it's, social events, whatever gives you that feeling of joy or relaxation, or kind of clears the stress from your mind. But I do think that, everything probably should be done in moderation. We all should eat less sugar. We all should drink less alcohol. If you drink alcohol, none of us should smoke. We should all eat a healthy, balanced diet and maintain a normal body weight. And that would probably mitigate a lot of the complaints that women complain about when they want their hormones tested.
Yes, absolutely. And a big one that I'm finding right now is sleep. A lot of disrupted sleep, which I know is integral to having balanced hormones, and stress management. And with kids at home, maybe school closures, daycare closures.
This obviously isn't my area of expertise, but finding that thing that makes you happy that you can do on a regular basis, and just make yourself a priority to do that thing and make sure that it's good for you.
Thank you so much for taking the time to speak with me today. Are there any final thoughts, Dr. Shoup, or recommendations that you would like to share with our viewers?
I just would like to encourage patients not to be ashamed and not to be afraid to come in. If you've gained weight, it's okay. If you've neglected your health the last couple of years, that's okay. Our goal as healthcare providers is not to be judgmental. Our goal is to help you get to a place where you're healthy and help you stay there and give you the tools that you need to hopefully help yourself stay in that situation. So, it always surprises me the things that patients are nervous about when they come in to see me, and it's not even on my radar. Like, I don't care if you've shaved your legs when you come see me. It's really, my focus is your health, educating you on your health, and trying to help you find tools to maintain your best self. So don't hesitate to make an appointment, get in. If you're behind, don't be ashamed. Your healthcare provider is there to help you.
Love that. I love that. I think that's great. And I will so often find myself saying, it took you 2 years to gain this 40 pounds. This does not have to come off over the next 6 weeks. Like, we're gonna, we'll work on it together. We'll provide some support. If you need to see nutrition, and it might take 2 years to come off, but we'll work on it. Well, thanks so much for your time. I really appreciate this. And I hope this reaches the ears that need to hear it, and that we start getting people back in.
Thank you again for the opportunity to be here today and to talk about these issues. I'm Brenda Shoup from AdventHealth Shawnee Mission, and please get in and see your healthcare provider we're here to take care of you.